Hey guys, we're going to talk about just the application of the Lucas device and what it actually looks like. So, on a code up on the floors, we're going to be conducting business as normal. Of course, we have to be in all of our full PPE before we even start CPR. You're going to get those one-step pads on the patient with that puck in the place where it needs to be, and you'll be doing your CPR. In the meantime, the emergency room is going to be responding with a unit called the Lucas device, which the nurse and the tech will be coming up with. It'll come up in a case that looks just like this. And as they respond, they'll open it up. This will be opened up outside the room, of course. And they'll put on their PPE, which comes with the kit itself. There'll be a second set of pads in there that they will replace that one-step pads that are on. The unit will come, they will pull a backboard out. This will slide up underneath it to connect to the underneath the patient. They will pull the unit out. As they're taking the unit out, they will turn it on, pushing that green button. It'll make some noise, get set. And then they'll also take out a neck strap. Those three units will go into the room with the set of pads. So they will push the green button, and it will turn on. It'll go through a test mode to check it. Compressions are still being applied right now. Manual compressions are still being applied. So I will approach into the room with all that equipment. I will place the backboard. When I'm ready to place the backboard, I will tell whoever's doing CPR, we're going to place the backboard underneath. We'll just pull the patient up in the bed just for a moment. On three. Ready? 1, 2, 3. I'll slip the backboard up underneath. We will start compressions again. I will lock this side into place. Okay, ready? Stop. We will pull the pads off the patient. Lock into place. Set the compress down. And start compressions. We'll be putting the pads back on the patient. Now they're using a different set of pads than we had before. The pads will be the Pro pads, and it's the old style anterior pads. So they just come in, they look at the pictures where they go. The one with the heart will go right where over on this side, and then the other one will come right up on top, is where they'll place pads that'll get plugged back into the Zolve, and they'll have capabilities of shocking again. The last thing would be the neck strap itself. The neck strap prevents the unit from sliding down or crawling as it's in use. What they'll do is they'll take the neck strap, they'll place it up underneath the neck. They'll just attach it to a little clip that's right on each side. And then they just tighten it down. Once it's tightened down, it's held in place. And this will continue CPR. Now what we need to do to run the code would be a doctor, a nurse, respiratory therapist, and somebody to run the Lucas device. It's a total of 4 people in a room. Everybody else can leave.